What were you afraid of at the time that was preventing you from accessing your own fulfillment when you were in that speaker training?
I think I was afraid of the uncertainty of not knowing how to transition into a different career. I had an identity, and I had a like high-paying job, and I had a family that was depending on me, and I was in a space where I knew that I couldn't keep doing what I was doing, and I think there was a fear around what am I going to do? How do I replace this? How do I find the path forward?
All right. Hello, everyone. Welcome back to the Recalibrated Vision podcast, where we are interviewing healthcare visionaries on their journey from career to calling. My name is Bianca Ariel. I'm the founder here at Recalibrated Vision, where we offer private strategic strategy, advisory, and done-for-you podcasting for physicians and healthcare visionaries building purpose-driven brands, businesses, and careers. So, I'm excited today. Today, we are speaking with Dr. Bob Uslander, founder of Empowered Palliative Care. So, Dr. Uslander has over 38 years of emergency and palliative care experience and has dedicated his career to transforming the way we approach serious medical illness and end-of-life care. So his work focuses on providing compassionate physical, emotional, mental, spiritual support to patients and their families during the most vulnerable times in their lives. And before today's interview, I actually met with Dr. Uslander, which I don't typically do, but I'm going to start doing because you get a lot of insight through those conversations to really drive a impactful conversation. And one of the things that I learned in addition to his tenure is that he also has experience helping physicians uncover their purpose. And so obviously there's a connection between really uncovering our purpose, our passions, pursuing our calling, because at the root of it, we are really trying to make sure that we live the most full and meaningful life in this space. And so I really want to dive into the connection between really pursuing your purpose and what that means for the end of your life as well. So if you enjoy conversations like this, please don't forget to like this episode and also subscribe. Dr. Uslander, welcome to the show. How are you doing today?
I'm doing great. Thank you. Thanks for having me.
Awesome. So I'm going to go ahead and just hop right in. What is the biggest misconception that we have around death?
just a just a little light
Yeah,
intro. The biggest
light start.
misconception, well, I don't know about the biggest. There's a number of them. Um, I think in my mind the biggest misconception is that death is going to be a scary, painful struggle. And I meet with a lot of people who have that understanding, that sort of preconception that it's going to be a real struggle, and there's a fear around it, and a lot of that misconception makes sense because a lot of people have seen loved ones, friends, people that they cared about struggle and have really difficult, challenging end of life experiences and deaths. And so that is, it's not hard to understand why people might have that experience, that belief.
It does feel scary, right? In the sense of ending your life, but what are some of the most beautiful parts of it?
Well, it allows when somebody enters into that phase, that end of life phase. There's so many different ways that it happens. Sometimes it happens very quickly, and things change quickly, and there's a lot of preparation leading up to it, and it's just now here you are faced with, okay, well, now dad's terminal and he's dying. There are other times where it's just sort of a series of events that ultimately end up where you end up being aware that, okay, now there's no more no more treatment. There's no more options. But I think the opportunity is to have real beautiful experiences that are shared, to focus on what's most important, which means you have to understand, you have to kind of go through a process of reflecting on what's most important at this point, what's most important to this person, what are they willing to go through, what are their thresholds. You're meant to honor that and to help create an experience for the individual who's dying as well as their loved ones that fosters open communication, sharing of love, and I think reducing harm is a big part of it. So the default system, the default healthcare system, doesn't really focus on preparing people for that experience. They keep pushing, they keep treating, they keep, you know, finding ways to extend life until, like somebody says, you know, until they cry uncle, right? Until something happens and they can no longer tolerate another treatment.
Yeah, there's definitely typically a catalyst where you do start to appreciate those beautiful moments and figuring out how you wanna spend them. Are there just different phases of grief, are there different phases of death as well?
Well, yes, there are. Yes, short answer is yes. There are different phases of dying, right? I mean, are you talking about the actual act of dying, or the actual like leading up to that
Yeah, so
and
something
life?
you said just kinda brought that up, like different phases that you go into, and I'll tell you what I mean specifically. So I used to work in long-term care, so I used to promote a neuroscience portfolio, and a lot of the residents that we used to focus on are residents with the Alzheimer's and dementia, and I always remember, speaking to my family members and saying, you know, "You really have a different perspective around death when you work in long-term care." To me, it's almost like once you lose your cognitive functions and you don't understand where you are or what you're doing, that feels like death to me, right? It's not the actual physical transformation because just watching people not not being able to have a quality of life or even know where they are is also disheartening. So that's what I was kind of trying to connect it to. Are there different phases? Like when we think about death, do we need to think about it in different phases versus just a physical transformation at the end?
Hmm, that's interesting. So I think what you're referring to is there's a death of the identity, right? In those situations when people lose their cognitive ability, there is something that dies. You hear especially when we're talking about dementia, Alzheimer's disease, or other dementias, when somebody is no longer able to communicate communicate effectively, when they don't recognize the people who are, you know, close to them, then their loved ones will often say, "We already lost them. They're they're not dead, but they're not really alive. Their body is physiologically alive, but but the person who's inside that body is no longer there. That person is gone." Which is tragic because people are often kept alive for a long time after their person, their identity has gone. And most of the time that happens because people never filled out the appropriate forms. They never completed appropriate directives and identified who would be the person to speak on their behalf. And so there's nothing documented about what they would or wouldn't want if they were in those circumstances. And even if people do have things documented, they wouldn't want their life prolonged, they wouldn't want to be kept alive. The system doesn't really, it's hard for the system to support that. It's hard for people who are in memory care facilities or nursing homes to be allowed to go, even if they had expressed that that would be their wish. So it's a huge challenge. I have a program that I take people through that helps them identify what's most important to them, what their thresholds are. If you lose your ability to communicate or recognize your loved ones, that you wouldn't want any life prolonging care or treatment, and you would want to be allowed to die peacefully. And some people are able to honor those. They find a way to be able to honor that. A lot of times it's really hard to do that.
What would they should they look for? Would it be called like an end of life care plan, or do you have a specific name that you use for your program?
Well, my program is called the Clarity Path, and I create a clarity based advanced healthcare directive. If for people, if you go to an estate planning attorney, or if you go online, or if you go to the Compassion and Choices, websites, you will find advanced healthcare directive forms. Every state has one that has some specific features for that particular state, and so people can get those. The problem with them is that most of them are inadequate. Most of them are very um, they they don't indicate anything deeper than CPR, no CPR. Would you want to be? Would you want your life prolonged if there was if you were terminally ill with no hope of recovery? It it's pretty black and white. And end of life or even they also come into effect if you're not dying, but if you're just in an accident, or if you're in a situation where you for temporarily can't communicate. But those forms, those off the shelf forms that people can get, they tend to not deal with the nuance, deal with the gray areas that are most common, and cognitive impairment being one of the most significant ones.
I can imagine being in emergency medicine, these are things that you're dealing with on a continuous basis. Did your perspective change on how you approach your own life, or how you see, purpose and death in your own perspective? Talk to us about your journey and how you got into this work.
Sure. So yes, my work as an emergency physician has definitely had a major impact on my perspective of life, and my feelings about life and death. I went into emergency medicine because I felt like that was sort of the epitome of being a physician, that you have to just be ready for anything, and have a broad base of knowledge and skills to be able to react um, quickly with it to whatever shows up. I really I liked the adrenaline of it. I love the being on, like, under pressure, and always not knowing what the next what every each day was going to bring. I like the variety of it. I like the intensity of it. That was kind of who I was. I also really enjoyed that you would work a series of shifts, and then you have time off, and so you were able to. I was able to fit other things in, things with my family and travel, and I could also go and become an ER doctor in a new town. I didn't have to build a practice and then leave it and build another one. So those were all advantages, and part of why I chose emergency medicine. I think over time, as I matured, I started paying more attention to some of the things that were very unsettling for me. And in the emergency department, it's sort of like a everything that isn't working well in healthcare sort of falls down into the ER. The ER is the catch-all, and you learn about a lot of the other challenges and problems, and the reasons people end up in the ER is because sometimes it's because they were not getting appropriate care or attention. They had complications of just surgeries, but it's the place that, when people would call the doctor and say, "Mom's got a fever," or "this has happened," or "that's happened," the knee-jerk reflex is send them to the ER. So I saw that happening over and over, and I saw people coming into the ER who had no business being there. They should never have had to come to the ER. They should never have been put through that. And then once somebody's, especially an older person, once they're in the ER, the easiest thing to do is just do a lot of tests and admit them to the hospital. and that serves a lot of different purposes. It protects the doctors. It makes sure you're not missing anything. It makes the hospital more money. So people get kind of churned through, put on this conveyor belt, and they lose. They're not a human being anymore. They're a commodity. And that started happening, and I started seeing we were treating and over treating, and I realized that there was a huge population of people who were not being respected and honored, and that was the elderly folks and the people who had cognitive impairment, and they didn't have any agency. Things were being done to them, not for them. And so over time, I started seeing more and more of that. And then I had an experience of a good friend of mine dying of melanoma, and I got to care for him at home through the sort of trajectory of his disease. And then ultimately, when he was at the end, I worked with a local hospice agency. First time I'd ever worked with hospice. I really had no clue what they did and how they did it. And that experience really changed things for me. Taking care of Darren and being there with him through his final months and hours of life was really transformational. And that kind of was the beginning of my shift into more of a palliative care, helping to create more of those kinds of experiences for people.
When we talk about hospice, and I've been in healthcare for 15 years, and it's kind of like a topic where we know what happens there, and then it's kind of like a dark hole after that. Nobody knows really what goes on unless you work in that field. So take us behind the scenes of what actually happens in hospice.
With respect to hospice, the hospice experience that I had with Darren was phenomenal. They were it was a special case. He was 32. The hospice nurse who took care of him and his family, she was just a couple of years older and had children about the same age, so it was really poignant for her, and she got very invested. This It was a small town. It was just one hospice, so everybody really showed up beautifully, and the social worker was helpful with helping his wife, who was 29 at the time, under, understand how to navigate things with their children, who were 5, 3, and 1. And so everybody showed up beautifully. That was 2001. So it's been 25 years. Hospice has changed a lot in 25 years. And also, hospice is different in different communities. Here in San Diego, there are over 150 hospice agencies that claim to take care of people in San Diego, which is a bit insane. The entire state of Colorado has 80 hospices, right? So and so hospice has become very different, and in many respects, hospice is now a big business, and there's
Right.
a lot of like venture capital and private equity gobbling up hospice agencies and profiting off of them. So there's a lot of inconsistency. There are still some really good hospice agencies, but there's a lot of limitations that are imposed on them and constraints. And I think, like you said, it's a bit of a of a black hole. When somebody goes in hospice, they the what they get some things that they wouldn't have otherwise, right? They get nurses coming to their home and checking on them and helping manage some symptoms and guiding the family about how to medicate and such. They get supplies delivered, they get medications delivered, and equipment like beds and oxygen and commodes and things like that. And there's a social worker who's assigned, and like a chaplain or a spiritual counselor. So they get some of these services brought to them at home, but a lot of times that's not enough, because the nurses come, they they check in, they do their things, they spend time charting, and then they leave. And the rest of the time, the other 166 hours of the week, the family's alone with that patient taking care of them. A lot of people have a loved one that goes on hospice, and then the family, shortly after that, they realize we're hospice.
Mm,
We're doing the hospice care. We're getting, a little bit of support. But one of the other challenges is when someone goes on hospice, most of the time they'll never see a doctor again.
really? Wow. Okay.
Really. Very few hospices actually have doctors that see patients or interact with patients or families. Most hospice is are completely run by nurses and nurse practitioners. There's always a medical director or a doctor who's available to on the phone or kind of to oversee some of the meetings where they discuss patients. But very, very few hospices actually have doctors taking care of the patients directly.
Wow. Okay.
Yeah.
Interesting.
Yeah. So, again, the hospice experience can be a a nice, supportive, sometimes beautiful experience, and the individuals who work in hospice are angels. Many or most of them are truly wonderful, compassionate human beings. The hospice system and the model isn't working very well right now. There's a lot of challenges. And so people get in and all of a sudden they realize all the things that they don't have access to anymore. Doctors, physical therapy, nutrition support. Uh, they can no longer have radiation that's going to help reduce their pain or other types of services. So it's important that people get educated and really understand what it is they're signing up for, because otherwise they have these expectations and then they get home and now they're faced with the reality, and a lot of times they're shocked and frustrated and afraid.
Yeah. So who typically makes the decision for the patient to go into hospice? Do they sign up for themselves? Does the family do it? Does, the physician sign off on it? Do they have the option to say they don't want to go into hospice?
Yeah. So typically hospice is suggested, brought up by a physician or somebody if the patient's in the hospital and they're trying to figure out what the next appropriate steps are, then hospice may be suggested if the patient or the family have expressed that they don't want to come back to the hospital again, or there are certain sort of triggers. Sometimes it's clear that the patient is declining, and they call the doctor, and the doctor says, okay, maybe it's time to focus on comfort, and so they may make the recommendation. If the patient is able to make their own decisions, then they'll have to be the ones to decide whether they're going to sign up for hospice or not. If they don't, if they can't, if they're too ill, or if they have cognitive impairment, then it's the family's the decision maker for the patient, the healthcare agent who would be the one to make that decision. One of the things that happens frequently, um, is that somebody's in the hospital and they're trying to decide what's the next steps. Are they going to go to skilled nursing to get to rehab? Are they going to go home? Are they going to stay in the hospital? And there's a tendency for people to get referred to hospice because it's the easiest way to get them out of the hospital. And because if they go home or if they go to some place, a skilled nursing or someplace, then there's work for the discharge planners and the case managers. They have to arrange for equipment and medications and transport and things of that nature. When somebody is admitted to hospice, the hospice company will come in and take care of all of that. So they will facilitate the transport. They will take care of getting the medications. They'll take care of all the things that the case managers and discharge planners no longer have to worry about. So there's this natural tendency for them to encourage a hospice admission, and because that's just facilitates things. And sometimes people are given sometimes they're given accurate information about what they're going to get, what they're not going to get, but they're so overwhelmed with all the information,
Yeah.
and they only hear parts of it. And so then they get home and they're again sometimes shocked to learn that they can't do this, they can't have that, this is happening. Um, so I'm not suggesting that hospice is inappropriate, or I'm not suggesting that people shouldn't be going on hospice, or that all hospices are deceiving people, or this is like the the standard. But it's something that happens with relative frequency. The misunderstanding, the lack of disclosure, maybe. Um, and I think people need to be advocating for themselves, or have advocates who can help make sure that they're getting the right information, and they're making the choices that are aligned for them, not that feel easiest, or um, are the simplest path forward.
So, through your experience in palliative care and working in the hospice arena, what does compassionate healthcare look like? And how is your approach different than what is currently going on today?
Well, part of this is kind of what I just shared. I don't work within the constraints of the healthcare insurance model, so I can spend as much time as I want with somebody, and we focus on quality, which is not what a lot of healthcare is currently focused on. Healthcare is focused on efficiency and limiting risk and extending life and profit. We focus on helping people experience the quality of life and us and peace. Um, I think compassionate healthcare is it's what it's care that is aligned for the individual. It's based on what's important to them, what they want, what they don't want, how they want to be cared for, and then creating clarity around that, and then supporting their team, their loved ones, other healthcare providers, caregivers, helping to support them in creating an environment that optimizes the quality of life for the person whose health is being challenged, and making sure that they have in place what they need to to not struggle.
Mhm.
And sometimes that changes, and you have to be available and responsive, and um, but the focus has to be on that individual, and what is most important to them. And then, of course, we find situations where the person is no longer able to communicate what's most important to them. So we have to base what we do on what they've communicated previously. And if they haven't done a good job of that, which many people haven't, then we have to base it on what their loved ones know of them. And sometimes that's really hard, because different loved ones have different ideas.
Years and experiences with them, yeah.
And so this is one of the areas that I speak about often. Not planning well, not putting a plan in place for what you would want if you can't speak for yourself. It puts your loved ones at risk of having a lot of conflict and potentially fracturing families. I've seen families broken apart because they had different ideas about how to take care of mom or dad, and those are really, it's sad to see that happen, but it happens pretty frequently, and it can all be avoided. Actually, it can all be avoided by just having the conversations and making sure everybody understands what's important to you, what you want, what you don't want, given the different scenarios that might unfold.
I love that. You mentioned that, along with the physical aspect, that you also support spiritually as well. And with, different families and patients coming from all different type of religious and spiritual backgrounds, how do you approach spirituality when it comes to end of life planning?
So spirituality is it's a concept that a lot of people there's a lot of different ideologies and thoughts, and for me, s- I like to say that our model provides medicine for the body and the soul. It's one of the so we take care of the physical body, but we also help people find healing. Even if they're not going to be cured, we can help them heal. And we do that through presence. through compassionate presence, through love. And then I have a team of people who share that, who share the this foundational belief that people need connection, they need to be heard and honored and touched. So we have massage therapists, and we have music therapists, and we have expressive art therapists, and acupuncturists, and grief coaches, and end of life doulas. And so we have a whole kind of network of people have who participate in different aspects of care. And not every patient and family is interested in introducing those modalities or these people, but those who are, we have experienced an enormous amount of comfort and peace and healing. And I have stories. I have a book that I'm in the process of writing. That I have some of those stories in there about some of the experiences of patients who have lived longer, better, more awake, because they've brought some of this spiritual connection into their life. And so I just facilitate that. I went through my own journey of in yoga and meditation and sort of awakening a number of years ago. So some of what I personally learned and benefited from, I wanted to start incorporating into the practice. And so that's just it's infused all aspects of the practice. And anyone who's open to it, we bring it. If you're not, that's okay. It's you get to do you.
Right. I think it's so beautiful that even though, like, because my next question was like, why do you think spirituality is not utilized more in the healthcare system? And I think that's an obvious answer. But I think what we also should focus on, and this is why I love the work that I do, is even if the healthcare system is not designed to bring some of these modalities into your experiences, just know that there's experts, professionals, physicians, there's so many different people in the healthcare industry that really want to embody this approach. We're having our own experiences, we're having our own awakenings, and we know the importance of what it means to really, be fulfilled, have purpose, and really heal. And even though the model doesn't necessarily allow you to operate it, there's a lot of people taking initiative to create independent models to really introduce this to people who truly need it. And that's why I really believe that people are called to do this, and our expertise and our experiences, such as yourself, are, what is the catalyst to make the change and make this happen. So I just find it so beautiful that, even though healing is not a part of the traditional healthcare system, there are still resources and companies that are introducing it and providing it to people. So my question is, when, say, a family or patient is being discharged from the hospital, or say they're in skilled nursing and someone approaches them and says, "Hey, your loved one has to go on hospice, or you have to go on hospice." Where does your company come in? Do they contact you at that point? Like, what would, like, that step-by-step process look like? And then after they connect with you, are they meeting with you to kind of come up with a customized plan, and you as the physician are, making the recommendations and putting the plan together for execution? Like, talk to us like a step-by-step process on how this would work.
Well, so ideally, people find us before they sign up for hospice.
Okay.
And the reason for that is, once somebody gets on hospice, then most hospices sort of take the approach that we're taking over, we're going to come in and manage everything and take care of everything. That's kind of that's how they view themselves, and that's kind of because that's all that's been available. That in most communities throughout the country, that's all that's available. When people stop going for aggressive care and treatment, they go on hospice, and that's what they got. And then there's nothing else. Sometimes they have to hire caregivers, or they have private caregivers, or but in general, hospice sees themselves as being the be all end all, right? And I think the people working in hospice understand that there's a lot of gaps and limitations, and a lot of times they're frustrated by that, and in some cases they have moral injury. I know a lot of people who are working in hospice who experience moral injury because they're not able to deliver the kind and level of care that people need. Um, so ideally, people will find us before then because there are times when hospice is not right for them, but they're not being told that, and they're not able to really discern. So because they're overwhelmed and they're naive. So we come in a lot of times, and we can do a lot of what hospice does in terms of facilitating the discharge and getting people home safely and quickly. Um, so getting involved, getting us to come in and do an assessment and then identify what's needed, and then we can help put a plan in place. It may include hospice, and then we get to help them, guide them to a hospice that we know is going to show up for them, and that we have good experiences with, because there are so many. And the hospice agencies that you might get referred to from a hospital or from a skilled nursing, it may not be because the hospice is the top quality. It may be because the nursing director of the hospice is related to the discharge planner. And there are hospices and people in healthcare who are also doing unscrupulous practices, paying, money under the table and things like that. So you have to be, I mean, I there is a certain amount of appropriate cynicism because it's happening, not universally, but it's happening. And that has and I think having an awareness of that is important. You have to know how to discern. And that's one of the things that we get to do is help people discern and make sure that so we're sort of co-piloting them. I think of it, one of the analogies I really like is I used to work on cruise ships. I used to be a cruise ship doctor.
Really? Wow, that's
I've
awesome.
been on
Like,
cruises in Alaska and the Caribbean and Tahiti, and it's been a while. But a ship is coming into port, there's a captain who's in charge of the ship. But when they're coming into port, a harbor pilot gets on board, because these are captains and pilots who know the territory. They know the waters. They know where the submerged obstacles are. So the captain is still the captain, but the harbor pilot helps to safely navigate the ship into port. I kind of see myself in a lot of cases as a harbor pilot. I'm helping people see the submerged obstacles, help them from running aground, help them get safely home. And so that's what we do. And then in addition, we bring in these other resources and these other supportive people who, a lot of it is just they make connections. They identify where the gaps are and what the needs are, and step in to create this really beautiful village of love and support around people. And then we find what they need. If hospice makes sense, then we get them on hospice. If going to the hospital and getting more treatment makes sense, then we help facilitate that. So there's no like, it's not formulaic. There's no bureaucracy. There's nothing between me and the patients and the families. They call, they've got my phone number. They'll text me, they'll call me. So it's to me, it's a beautiful model, and I can't imagine doing anything different at this point.
I love it. I love it. And to me, you're a guide, and you're an advocate, and it's kind of what it feels like to me is we have a lot of conversations out around really advocating for yourself, but what does that really mean when you don't have the information? So, that the hospital, they have a system in place, they're going to make all these recommendations, but you don't know whether what's right, what's wrong, if this is, what direction to really go, if they have your best interest at heart. And so, having somebody like you that they can access even before this decision comes to really pick up the phone and say, "Hey, this is what's going on, what should our next steps be?" is like having an advocate that is going to look out for your best interest, that really is going to, guide you with with the best path that is best for you without you having to rely on the healthcare system. And I think that's a beautiful package. So, congratulations on the curation of that as well. So, we're going to wrap up soon here. So, my one of the things that I forgot to circle back to was what you were learning about yourself through this experience. And you mentioned that you had your own awakening, right? So what was the catalyst through your awakening, and what are some of the things that you learned about yourself during this phase?
So, one of the most profound things, and one of the most profound examples of that is I went to a seminar on speaking, being a presenter and a speaker, and how to share a message. And I was kind of trying to find my message at the same time. But I was in a process. This is back in 2010, and I I knew that not I was not going to stay in emergency medicine for much longer. I was really at a point where I knew that I needed to find another path. Didn't know exactly what it was, but it was sort of um, percolating. And I went to this conference, and there was a session on finding your purpose. And I believe the gentleman's name was Tim Kelly, and he kind of took the audience. There was a few hundred people in this room, took everybody through this process and through this exercise. And in that moment, I became very clear about what my purpose is. And and I have done a number of exercises since then, and I've done different explorations. I went through a coach training because I wanted to be coaching and learn coach techniques, and every time everything I've done has just reinforced. And I think what I become, what I've put in place in this practice and in this business is around that purpose. And it's essentially to help people move through fear so they can connect deeply with themselves and experience the meaning and joy of life. It's all around helping to remove the fear that blocks people from seeing and experiencing the light within them. And once that fear can be, that you don't necessarily, you can't always get rid of it. You can't always, but you can transmute it. You can learn how to move through it, work through it so that you have access. And once you have access, then you can sort of continue working and open yourself up to experiences that will further push that fear away. So a lot of what I do is help give people the access and the clarity and the support so that they have that they can connect and experience more joy and meaning in life. So that's sort of infused a lot of my growth and decisions over time. And then I had in 2013 I had essentially what I would refer to as an epiphany, like a download that also has directed my course. It was essentially to I heard that I am here to help people die better and live better up until their death. And that set me on the course of palliative care and end of life care. So those are a couple of the things that happened that are like, there's no question that this is where I'm supposed to be.
What were you afraid of at the time that was preventing you from accessing your own fulfillment when you were in that speaker training?
I think I was afraid of the uncertainty of not knowing how to transition into a different career. I had an identity, and I had a like high paying job, and I I had a family that was depending on me, and I was in a space where I knew that I couldn't keep doing what I was doing, and I think there was a fear around what am I going to do? How do I replace this? How do I find the 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 path forward?
Mhm.
And it was a journey, and it's still a journey. I'm still on it, but
Right.
it took some time, and I had to. It took a lot of courage to walk away from what I walked away from in order to find what I was meant to be doing.
Was there a point where I'm assuming, like, the calling or the download was just louder than the fear, that essentially encouraged you to move through it or transmute it?
Well, I think I had moved through a lot of the fear by that time. And I
Okay.
think part of why that happened is because I was sort of like a receptive. I was receptive. I was sort of an antenna for it. And it wasn't. I mean, it was sort of out of the blue when I experienced that. But the very next day, I met randomly. I ended up being invited to go to like a festival with somebody, a friend of mine, and I didn't want to go, but I did, and because there was going to be good food there. And so I went, and as I was leaving, I was walking past some vendor booths that were people there promoting their services and companies. And I walked past one, and I just kind of met eyes with a woman behind a table. And turns out she was there to promote her palliative care and hospice program.
Mm.
And I started talking to her. And this is literally 12 hours, 14 hours later. We started a conversation. And a few months later, I was now the director of a new palliative care program that was being built in San Diego. So that was my entry point into palliative care and hospice care. So that, you know,
And I think the most profound thing is the fact that you were open.
I was
You were
open.
open to it, you were receptive to it, right? It's like if someone is experiencing that fear of uncertainty, what is one thing that they can do? It's simply just be open, be receptive, to where your path can go to next. So, thank you so much, doctor. I really appreciate our conversation, and I really, congratulate you for answering your own calling and being open and receptive, and, thank you so much for not only the work that you're doing with Empowered Palliative Care, but also for having the courage to really go out there and know that you and see these gaps in the healthcare system and do what you felt called to do, which is create this model that would be supportive and empowering for your patients and their families. So I am, thankful for our conversation today, and I hope that it not only can start families and patients to really start thinking about their end of life care and what that means for them, but also anybody who's in healthcare that sees these gaps and no and has that moral injury and wants to create and feels called to create something that they know is going to make an impact. Hopefully, we can encourage them to start taking those steps today. So, thank you so much. I really appreciate it, Dr. Uslander. Where can people connect with you and find you?
So I have two different sites. One is Empowered Endings, and that's one of our services, Empowered Endings, and the other is Empowered Palliative Care. So those are the two sites, and we're also on LinkedIn and Instagram and all your and all your favorite social media channels.
Awesome. I'll make sure I'll put that all in the description below. Thank you guys so much for tuning in. If you enjoyed this conversation, make sure that you share it with somebody that you love. If you're a physician or a healthcare professional considering a new career, brand, or business, we'd love to support you. I'm Bianca Ariel. I'm the founder here at Recalibrated Vision, where we offer the Recalibrated Career Academy to help you uncover, design a strategic plan, and implement and execute your next path. And we also offer the Physician Podcast Concierge, where we help you amplify your voice through Done For You podcasting. Thank you so much for listening in this week. This is the Recalibrated Vision podcast, where we are releasing, resetting, and recreating our own lives. Make sure you always and forever stay free. I'll see you next time.